Gentlemen, allow me to pose a candid question. Imagine if I revealed that a coin-sized area on your body, when gently massaged for merely 60 seconds each day, could rejuvenate blood circulation, heighten sensitivity, and rekindle the vigor that time may have diminished. It might seem far-fetched, perhaps even slightly uncomfortable to consider. Bear with me, though, because over the next several minutes, I'll pinpoint precisely where this area lies, explain the science behind its efficacy, and demonstrate how this uncomplicated ritual could deliver the profound, all-natural enhancement you've been overlooking. Before we proceed, a small request. Tap the like button if you're invested in preserving robust health beyond age 50. Drop a comment sharing your location. I truly enjoy witnessing men from every corner of the globe rallying together. And please subscribe to ensure you receive upcoming content focused on male wellness, energy, and self-assurance. Very well, let's uncover the reality of this concealed zone. The majority of men assume that once they cross 50, challenges with performance are an inevitable consequence of aging. They accept that circulation diminishes, testosterone levels plummet, and closeness grows increasingly elusive. Consequently, they either disregard the issue or turn to that familiar little blue tablet when nature falters. Yet here's the revelation. Aging itself isn't the true adversary. The genuine culprit lies in pelvic constriction and compromised blood flow. Through decades of prolonged sitting, chronic stress, and physical inactivity, the pelvic floor muscles, those responsible for governing erections, urinary control, and even tactile sensation, simultaneously tighten and weaken. Visualize a weathered rubber band, overstretched, rigid, yet devoid of elasticity. That's precisely the scenario unfolding within your physiology. Blood vessels harden, nerves become compressed, and processes that once occurred effortlessly now demand exertion, or fail entirely. The encouraging news: by alleviating tension and invigorating circulation at the optimal location, you can effectively recalibrate this entire mechanism. This particular point has been acknowledged for centuries across traditional healing systems, and contemporary research is now elucidating its mechanisms. For newcomers to this channel, I'm Dr. Rachel Collins. With more than 7 years in medical practice, I've guided countless men toward reclaiming vitality, poise, and well-being without resorting to superfluous medications or invasive interventions. I've witnessed directly how modest, organic strategies can resurrect the dynamism and connection men believed were lost permanently. Today, I'll introduce you to one of the most underutilized yet transformative methods at your disposal: perineal massage, sometimes referred to in ancient traditions as the $1,000,000 point. However, prior to instructing you on execution, let's examine the prevalent errors men commit that sabotage their potency, errors this massage directly counters. Error number 3, overlooking pelvic tightness. Few men recognize that their pelvic floor muscles remain perpetually contracted. Everyday stressors, extended desk time, even delaying urination, all contribute to muscular lockdown. The result: constricted blood vessels, dulled nerve endings, and sluggish circulation. This massage dissolves that concealed rigidity, akin to loosening a stubborn knot that's been throttling your capabilities. Error number 2, depending exclusively on pharmaceuticals. Tablets may provide momentary relief, yet they fail to address the underlying dysfunction. They artificially induce blood flow for a brief window, but neglect to rehabilitate vascular elasticity or neural resilience. This explains why efficacy diminishes over time. Conversely, this approach re-educates your body organically, cultivating authentic, enduring progress. Error number 1, equating age with inevitable deterioration. The most detrimental misstep is surrendering optimism. I've treated innumerable men in their 60s and 70s who presumed they were beyond recovery, until we revitalized circulation and sensation. In mere weeks, their self-confidence and relational intimacy resurfaced. Now let's transition to application. Here, the step-by-step process. Step 1, locate the area. Known as the perineum, it resides midway between the scrotum and anus. Centrally, you'll detect a subtly softer region. Initial tenderness is normal, it confirms accuracy. Step 2. Assume a relaxed posture. Perch on a chair's edge or recline with knees flexed. Prioritize accessibility without wrist strain. Step 3. Exert measured pressure. Employ your index and middle fingers, applying the same force you used to assess a tomato's ripeness, firm yet painless. Step 4. Massage for 1 full minute. Experiment with petite circular motions, 30 seconds clockwise, 30 counterclockwise. Alternatively, alternate 5-second firm presses with relaxation or perform subtle up and down pulses. Step 5. Incorporate beneficial oils. This amplifies outcomes dramatically. Castor oil delves deeply, enhances blood flow, and mitigates inflammation. Coconut oil offers gentleness, antimicrobial properties, and hormonal balance. Black seed oil elevates testosterone, renowned in Middle Eastern therapeutic lore. Always warm the oil in your palms beforehand. Chilled oil on delicate tissue is unpleasant. Step 6. Establish routine timing. Perform daily. Optimal moments include mornings when testosterone peaks or evenings to unwind and bolster nocturnal and dawn erections. Treat it as physical training. Regularity trumps duration. 1 minute daily surpasses 10 minutes weekly. I understand that some of you might feel uneasy simply contemplating this. Perhaps you've never explored this region of your anatomy. You may wonder, is this truly appropriate for me? Allow me to affirm, absolutely it is. This practice isn't odd, nor is it degrading. It's about reclaiming functionality, dignity, and autonomy. A 62-year-old patient once confided that he'd abandoned all hope for intimacy. Following 3 weeks of diligent application, not only did his performance rebound, but he experienced unforeseen benefits. Chronic hip discomfort vanished, urinary regulation improved, and he rediscovered his authentic self. That's the broader impact, not solely bedroom prowess, but enhanced daily living. In summary, gentlemen, dedicate 1 minute daily to massaging this area, enhance with natural oils, maintain steadfast consistency, and within weeks, observe transformations no pill could replicate. Refuse to let chronological age dictate your vibrancy. Modest, deliberate habits can rejuvenate not only your physique, but also your assurance and bonds with loved ones. If these insights sparked optimism, kindly press the like button. It ensures this knowledge reaches more men in need. Subscribe if you haven't yet. We're cultivating a brotherhood of males unwilling to relinquish their well-being. In the comments, declare one adjustment you pledge to implement this week. This is Dr. Rachel Collins, affirming that you're neither damaged nor past your prime, and you most certainly can reclaim vitality. Initiate one modest action today. Your tomorrow's self will express gratitude.